Please listen carefully.
Hello, universe, and welcome to the Optimist Daily Update. I'm Amelia Buckley.
And I'm Kristy Jansen, and we're part of the team behind the Optimist Daily, making solutions the news. We bring you reader-funded solutions news every day in order to change the tenor of news media, social media, and the direction of your day to help make it one focused on solutions.
7 days a week, we publish positive news stories written by award-winning journalists and delivered online to your inbox and through our social channels. And now we are sharing these solutions in a commute-worthy, walk-worthy, You Have a Guest Today worthy podcast. Today is Monday, the 5th of April, 2021. How are you today, Kristy?
I'm well, Amelia. Happy Monday. Happy Monday in April. The first Monday in April, I guess, that's what today is. So we have great stories on today's Optimist Daily, but we're not going to talk about them today because we've got something a little more deep, a little bit more impactful, I think. With the last year, the trauma that all of us have been experiencing, some more than others, it's really put a big weight on all of us. Mass shootings in the last couple of weeks have been really shocking. Over the summer, the unrest was shocking. And then just the COVID responses there have been really upsetting for many of us.
Yeah, so today we have a guest, and we're going to be talking about not only the trauma that has resulted over the past year and the various things that have happened in our world, so some of the coping strategies that we have that both psychological professionals and us as everyday humans can take to support not only first responders, but also, everyone in our community, our friends, our families, and even ourselves. So do you want to introduce who our guest is for today?
Today we're talking with Jina Carvalho, and among other things, Jina serves as the Public Information Officer, as well as the Volunteer Coordinator and Managing Director for the Santa Barbara Response Network, which is a community-based grassroots organization offering psychological first aid for individuals affected by trauma, suicide, violence, disaster, so many instances of trauma. She's also the Marketing Communications Director at psychalive.org and the Glendon Association, which is a nonprofit dedicated to saving lives and enhancing mental health by addressing social problems of suicide, violence, child abuse, and troubled interpersonal relationships. And Jina is one of those people she's a compassion worker. And I've known her for years. I've worked with her. She's a fantastic human being. And I'm thrilled that she is available today to talk with us on the Optimist Daily Update. Jina, welcome.
Thank you. And thank you for that wonderful introduction. And it's been a pleasure to work with you and to be a part of the Optimist Daily. Thank you.
Yeah. And Jina, by the way, is also an emissary of the Optimist Daily. And we've been thrilled to have her as one of our audience members. And today I wanted to talk with you, Jina, because I know that PsychAlive is going to be hosting a series of free webinars specifically designed to support caregivers and first responders during the COVID-19 crisis. But before we actually started recording, you mentioned that there's some other traumas that have become even more present and pressing in the last few weeks. And I wanted to ask you first, why don't you tell us a little bit about what you are doing with psychological first aid and how you're involved with addressing those kind of psychological wounds, sort of the triage on the front lines of these kinds of issues.
Mm-hmm. Thank you. Well, with Glendon and PsychAlive, and even with the Response Network, we're committed to mental health and understanding what goes into a person's responses when they're traumatized and what are the most effective ways to help them heal and go beyond their experience of trauma. We've found that utilizing psychological first aid, an evidence-based response to dealing with trauma, has been highly effective and something that anyone, including children, adults, volunteers, anyone can offer that.
So why don't you tell us a little bit about the origins of how you got involved with psychological first aid as an idea and then creating the Santa Barbara Response Network?
Yes, so we had a cluster suicide in our community, which was like people were calling copycat suicides in our Latino community. And we had a very difficult response because that community was not as open to mental health services in response. So we brought in an expert in psychological first aid to train us in how to do the outreach and bring down the extent of community-wide trauma that was happening and kind of arrest the suicide cluster. So that was 12 years ago. And since then, we've had several other incidents of repeated suicides in our schools. But then we also had a lot of natural disasters, mudslides, a mass shooting at the university. So our response network was formed in order to be able to go in as trained volunteers to be able to respond in those situations. So we formed the network as a way to offer to anyone psychological support and stabilization and coping skills.
And so that's what SBRN is, the Santa Barbara Response Network, your volunteer grassroots organization, and you're supporting your fellow community members through traumatic events. And I think that there's
exactly,
and basically anybody can get training in the psychological first aid.
What are some of the basics of psychological first aid for our listeners who are unfamiliar with the term?
So there are basically very simple 8 core actions to psychological first aid, but they all center around stabilization, grounding, connection, and then referral to ongoing resources. It's not therapy. It's not a fixing model. It's a community member to community member, friend to friend response so that we're on the same footing. And we're going to help you, guide you through this experience of trauma to the other side. So it's a very equal situation, and that's why it doesn't have the stigma of therapy. It's not provided by any organization, or we accept volunteers. We come in sort of like the Red Cross.
Yeah,
I'm going to call it the Red Cross for the soul.
It's like compassionate support to aid in recovery and resilience. In the moment. So it's triage almost. It's not fixing.
Exactly.
I think you were telling me before that Santa Barbara Response Network is it's not that common. You've been working in this area for 12 years in Santa Barbara, and we've had forest fires, we've had mass shootings, we've had disasters, and you guys have been on the front lines there in different ways, and then connecting the community to more support services out there that are available. Is there evidence that this has been an effective model of dealing with community support?
Yeah, I think highly effective. And I think that I'm going to be working with the university here to do some research and some empirical research on, how are these families doing? How are these individuals doing since they've been impacted by the Santa Barbara Response Network and psychological first aid? We are trained, and we're trained through the National Child Traumatic Stress Network. There's a lot of information there on their website about the research behind psychological first aid. And it is highly effective and utilized in war and in situations where there's heightened community trauma.
And are you in a network of helping organizations, or are you relatively unique?
I think we're pretty unique. I've been trying to find others that are organizations like ours in the country. And I'm actually going to be in touch with someone because we want to bring further training into Santa Barbara on this. But I'm not aware of other models like this. And partly because we have such a strong collaborative network here in Santa Barbara, from law enforcement to schools to mental health agencies, that we have such a broad collaborative response that I think it's very unique.
So why don't we talk a little bit about some of the work you've been doing lately over this last year and some of the things that Psych Live is getting prepared to address in this series of webinars?
Well, when we were planning, and with Psych Alive, every month we plan a series of mental health webinars focused on issues that we feel are impacting our listeners. And one of the most important things is what's happening to our frontline workers that over a year and now being impacted by all these mass shootings. What's happening to these people? How are we supporting them? And we decided to create a series of webinars that would offer that kind of support based on the psychological first aid model. So what we're looking at is how do we support these people by their own people. If clergy are going to speak, we have a clergy person talking to all the clergy that's been on the front lines, a paramedic talking to paramedics. So it's very much a teaching in the sense of an expert coming in, but one of them helping and guiding them through this. And we thought that was really important, the lived experience. And we wanted to offer this. And we're really honored to have some of the speakers that we have on our series from around the country, providing this kind of support. And it'll be recorded and available.
And these are free
for anyone
webinars.
Needing that kind of. Yeah, they're free webinars. It was a commitment we had to mental health support for these very brave, unsung heroes.
And why do you think that the peer-to-peer kind of compassionate caring is so important in these situations? How is that different and more effective?
I think even with our response in the community here, if someone's lived through the experience that they're sharing with you, it carries a tremendous amount of work. Our work in the suicide field and suicide prevention, both through PsychAlive, Glendon, and SBRN, that we find that when a lived experience, a person who's lived through a suicide attempt and survived, carries a tremendous amount of validity to that person who is struggling with suicide, because they can give you firsthand what worked, what didn't work. They know what the person is thinking and feeling firsthand, and they can guide them with much more sensitivity than someone who hasn't been through that experience. A paramedic on the front lines of COVID is going to know what a paramedic on the front line of COVID is feeling much more than you or I, or someone who's an academic.
We've been stuck at home and we're dealing with our own crisis about the lack of our friends and family, but we have no idea what it's like to see people, having real physical problems with this. And how do you deal with that, right?
And I know their family members too.
Right. And the family members and the people who they can't even be with them in the time of stress. How do you help the people you're used to getting the family, having them come into the hospital room and sitting with them? And that's not available. The emergency room nurses are having to sit with these patients because they're the only ones who can.
And their families are hurting too. So there's support for the families of the first responders are so important. These people are struggling, trying to support their loved ones and also feeling the isolation. These are such unprecedented times. So anything we can do to offer compassion is very appreciated, I think.
Has there been a rise in suicide and other sort of trauma sparked issues, mental health crises with first responders that you know about, Jina?
Yeah, there has been. And the mental health issues that the isolation has brought to our youth, the lack of social contact, these families under tremendous stress economically, emotionally, there's been a huge burden. We're expecting a mental health surge of mental health needs like we've never experienced in this country. I think there's a rise in alcohol and drug consumption. There's a lot more accidental deaths, which we don't know what exactly we mean, but there's been an increase in that. I think that people are feeling that lack of connection. So I believe that healing comes with as much community support that we can offer, the better.
I'm curious, during the pandemic, how has your organization been continuing to offer your resources without the availability of physical proximity? How have you been extending your services in a socially distant world?
Thank you for that question. It's really been difficult for me. I love my team. I work very closely. We're a tight-knit team working together for many years. Glendon for over 30. So our team, we are so, there's such a sense of joy and camaraderie, and that face-to-face is gone. We continue with as much support as we can on Zoom. We have regular meetings. We try to meet as we can socially distant, but it's been difficult. But we look at these issues and we think, okay, what would we need right now? And we did a webinar last month on grief, and we realized that so many people are grieving not just the loss of loved ones, but loss of your workmates, your friends, your extended family. So we've tried to bridge that with offering these webinars, these information, the blogs, videos, conversations at home with experts to help guide people and support people through this. So that's given us tremendous meaning, a sense of meaning and a sense of purpose through these times. It's sort of fed our heart to be able to offer this. And that's helped us a lot through this time.
And I think that I've heard you use the term compassion centers. And I think
Mm-hmm.
I know that in other times when it's not so hard
Mm.
to be together physically, that's been something that you can go and actually volunteer your time and talk with people, give them a chance to have that connection. Is there anything you've been able to offer in a similar way ongoing besides webinars
Mm-hmm.
through SBRN?
Yeah, I'm so glad you asked that, because when the pandemic hit, the Compassion Center model is something we created. It's trademarked by us, and we created it after the shootings in Isla Vista at the campus, University of California campus. And it was such a broad, there's so many people impacted, from community members, students, faculty. I mean, it was so broad that there was, how are we going to offer our support to such a broad area? So we set up centers at various locations at the university and in the community, and we call them compassion centers. And we had t-shirts that said Compassion Center, Compassion Patrol. And we walked the streets and basically said, talk to me, like, what's going on? And people could come into a center, which is basically a safe space. And we would offer refreshments and have volunteers there throughout the day and evening, and even in the parks, so people could come and share what was in their heart and just get a hug, just come and get a hug. So then we thought, what are we going to do with COVID? So we went online, and we have compassion centers every week on Facebook Live. And we bring in people. And yesterday we had a wonderful conversation on racism, and the effects of this on our community. We had the director of public health, who's an Asian American woman. We had an African American male whose mother was Korean and who's Black, and a Latino man, and all talking about their experiences and how can we heal through these experiences. So that Compassion Center rolls out every week in English and Spanish, and soon to be in Mixteco, in Indigenous language. We're very committed to equality here, and the model is based in that, in equity. We also now, I'm very, very excited, we have a homeless outreach project. So once a week, we are going to be at a park here called Alameda Park in Santa Barbara. We're going to have volunteers there at a compassion center from 2 to 7 on Thursdays to talk to our community members who are homeless, families, individuals who just want to talk, and hopefully offer them some mental health resources. So we're really, really pleased to be doing that. Our compassion centers have been set up in this, whenever even recently, there's been some suicides and some homicides. So we set up a safe space outside where people could come and just talk.
Do you think that because of the social isolation and just the cumulative stress, and I mean, I know that these webinars are focused on the first responders, and we can talk more about that, but I feel like sort of the heightened emotional trauma that we're all carrying with us has bled out into the communities. And now the systemic racism has been there for a long time, and it's finally coming out. It's almost like the wound is starting to seep and you can't ignore it anymore. Like, I'm just curious for you, you've been working in this sort of crisis communication area for a long time. Like, what do you say to a community who's experiencing this kind of instability? How do we sort of bring the truth out there and then heal from something like a mass shooting, for example, like the Georgia shooting, or I think there was one in Orange, California? How do you address these things? How do you help people move beyond it without getting stuck in the anger and the grief and the pain?
I think that the very first thing is that we have to create safe spaces where people can talk openly and process what's going on without judgment. We need to dialogue and keep the conversations going. We need to keep this dialogue going forever. The strength comes from the community and all of us speaking together and naming what we see, not shying away from it, we need to keep that going. And that's why we wanted to have this conversation last night and create more safe spaces.
Mm-hmm.
I think that we need to talk about how are we going to talk to our children about these issues? How are we going to create a new world? And what kind of world do you want to live in? We need to help ourselves to find safe space within ourselves. Very important in ourselves and in our families. How do you feel safe? What keeps you feeling a sense of security, safety? Finding that, really taking care of yourself and providing that calm for yourself and for your children, if you do have children, not shying away from answering questions, keeping routines going. I think it's very important that we not get so muddled in our lives that the days all run into one another. That's a very powerless feeling. Very important, especially for children, that we keep routines, that we keep as much as we can our life going, so that that trauma doesn't seep in and completely take over.
Mm-hmm.
And I really think it's important for all of us to say, hey, I'm having a bad day. This is really hard for me. I'm really hurting right now. I'm really hurting. It's okay to not be okay. It really is.
Mm-hmm.
And create that support system for yourself. Who do you turn to? Who do you talk to? It's really okay.
One of the things that I find unique about this particular experience is that usually, you know, like, for example, when there's a trauma in our community here in Santa Barbara, other places in the country weren't also going through that trauma at the same time. You know, usually if you're having a bad day, if one person's having a bad day, their friends around them are, their lives haven't been that affected, right? You can go to your friends, you can go to your other family members. But in this particular case, so many of us, like everyone is living in a different world. It's not like it's easy to find somebody who hasn't been affected. And so it's just interesting to take that, like what you're talking about, being able to say, hey, I'm suffering, but all of us are. And how do you bring that compassion to yourself and then also make space for creating safety for you and for the people around you? And I guess you haven't done the first responders webinar yet. The first one is going to be on Wednesday, and then it'll be each Wednesday for the rest of the month. Is that how it's working? Right. We'll have a link in our notes to so people can sign up for those, and those are free, offered by Psych Alive. Are there things to not do? Are there things to avoid when you're offering the kind of support, you know, so you don't get into traps of overstepping? Maybe, I don't know. Like,
It's so important when we train our volunteers, and we do trainings. We have one coming up on April 17th, psychological first aid, all free to the community. And then we get invited into agencies to train their staff, like the food bank, like the library, like the homeless. We go in and we create training specifically for the needs of that organization. And exactly that's what we address. First of all, we never show up anywhere where we're not invited. It's kind of good grace, but, we get invited in. The school calls us and says, we've had a suicide, we've had a homicide. Can you please come in and support our staff? We get invited. Then we go in teams. We never go alone, always in teams. You always go with someone, and that's just in life, just so you don't feel alone. We're very cautious of the language we use, very respectful of the families and situations we come into. Our volunteers, most of them are bilingual, and now we're extending that to the Indigenous community so that we can help there. We try to come with such an air, we try to be so respectful of the person that we're coming to help. And that's, I think, really foremost. Things that I'm seeing that people are doing that are hurtful. Overuse of media. I really encourage limited media viewing. When these incidents happen, we get re-traumatized all the time. Shut it down at a certain point. And I can't stress enough, which people are really hurting with this. They're not sleeping, and people aren't taking care of their physical being, which then has ramifications for them emotionally. And an overuse of alcohol and drugs to numb ourselves. So that is just being cognizant of all those things, treating yourself with compassion and caring.
And I guess that goes to maintaining
being so kind.
those kind of basic routines. I mean, just like brushing your teeth, regularly, and having
Mhm.
breakfast and going to sleep, and not just getting sucked into the vortex of social media or news reporting on things which are frightening.
I'm
Mhm.
curious, you discussed
Yeah.
how much cultural factors impact a community's trauma response. And so I would imagine is cultural training a big aspect of psychological first aid? Is that a big component of your training programs?
Yeah, it is. It's included in all the core actions when we think about stabilizing, we think about resources. Some individuals and communities don't believe in therapy, don't believe in certain ways that we just take for granted. Oh, we go and see someone. Well, that's not, they may go to a healer, they may do a very different thing to take care of themselves. Physical proximity, some people, really being cognizant of space and culturally sensitive ways to talk about the issues. Yeah, we do include that in our training. And I think that we all try to, as I said, approach each situation with respect and curiosity.
Mhm.
Learn from the person that we're trying to help. What is hurting you? And
Right.
how can I help you? We don't come in with a preconceived notion, and that includes the cultural piece.
Mhm. Yeah, and staying curious and asking, "How can I help?" instead of telling somebody how you're gonna help them.
Mhm. It's interesting because the most important thing we practice, we do role plays, and now, we do them in break rooms. We've been doing them on Zoom, but we do practice sessions. And I spend, and most of my time in the training is on the very first step of psychological first aid, which is the engagement step, which is how do you form that connection and engagement with the person.
Mhm.
And the first thing you ask is it okay if I talk with you? Is it okay? It's you approaching someone, we don't assume, and they may not want to talk. They
Mhm.
want to be still. We look at how to be tuned in to people, not just with words, but
Mhm.
how to be present. It's difficult now on phone and Zoom, but it's possible. It's in a
Possible.
voice,
Right.
it's in your voice.
It's interesting though to think about, like, so much of being present is actually the physical presence. And for me, one of the things that I find very exhausting is always having to listen carefully, or if I'm on a Zoom conference, watch really carefully. So much of just being with another person, which is what calms me down, is just listening to them breathe, and sort of having the breath
Yeah.
in the moment. The pauses are just as essential as the reassurance, the verbal reassurance. So it's interesting to figure out how to do that effectively in a remote setting.
hmm
That's
It's
that's
it's
just
a challenge.
that's a challenge as an aside. It's interesting that you mentioned that so many people have been, they don't believe in therapy. I have heard so many more like advertisements for different therapies. There's online therapists now. The evolution of telehealth sessions, which we've all kind of gotten used to. It seems like therapy might be more available and more available to more people. I'm curious if you have any comments on that or thoughts on that, and moving into a time, an era when we can actually go back to interacting in person. I wonder if therapy online and remote, and even your compassion center on Facebook Live, are you going to keep those kinds of engagements, do you think, or do you think you'll suspend that, the digital presence?
hmm it's been interesting talking to my colleagues. I'm part of a very broad network of mental health people responding in the community, and they've had more people coming in for therapy than they've had before. That the person wanting therapy has been more comfortable doing it in some ways online.
Hmm.
Therapists have waiting lists. There is more people seeking services because I think it's a little easier for them
Hmm.
to do it from home. And it's been very interesting. I think I would keep both going.
Hmm.
I think there's an effectiveness, and I agree that face to face is really so healing, and the energy that just gets picked up between people, the unspoken. But I think the other has been very effective for some people who are afraid of contact,
Well,
who
the
are
other,
hesitant
yeah.
to sit in a room with someone.
And the fact that you don't have to go out to do it, it also, maybe the stigma of going to a therapist is cut back because you can sit in your car and be on a phone call with your therapist. Nobody knows who you're talking to. You can do it even, you don't have to tell your family that you're seeing somebody.
In addition to that, I've heard a lot of
Yeah.
arguments in terms of accessibility, because if you know a single mom who can't afford childcare, it's really difficult for you to make it to a weekly therapy appointment. But if you have access online, then you don't have to seek out childcare. Or if there's no therapists that accept your insurance within a reasonable radius of where you live, online therapy is a way to access that. Or even if you live in an area where there are no therapists, period. I mean, people that live in really rural communities are seeking out these resources because they've just never been available before they were put online.
Yeah, that's so true. That's so well put. Absolutely right on.
Hmm.
All of that. It's made it a lot more accessible for a lot more people.
Well, it's so interesting. So why don't, Gina, do you want to talk a little bit about the webinar series and how that's going to work, and
Yeah.
finish this up by getting really into that and sharing how people can really get involved?
Mm-hmm. Absolutely. Yeah, I'm so honored to share this series. We wanted to offer this and make it as easy as possible for people who are so busy. So that's why we want to do the live. So every Wednesday at 11 Pacific time, we'll be offering the live webinar where a person can ask questions of the presenter and they'll have an opportunity to be there with them. But then we'll record it and make it available ongoing. We have the first responders that were the first webinar will be for paramedics, law enforcement, anyone that's dealing with that first response after any incident of violence or within the pandemic. And we're going to be talking about how they can be supported mentally, physically, emotionally. We want to offer tools and techniques for each of these individuals to be able to help themselves and their families.
Just so that the target audience there then is actually, it's a tool for first responders themselves.
Yes. Yeah. We're going to offer tools to the first responders to help themselves and family members of first responders. How can we help you through this time? We're offering them tools and resources. The next group that I think's been highly impacted are clergy. And by that, I mean lay clergy, chaplains who work with law enforcement. Chaplains go out with law enforcement when there's an incident and offer psychological and spiritual support. And these people have been extremely taxed with oh my goodness, all the deaths and the inability to provide funerals, burials. They're going to be talking in our second conversation, the essential work of what are we going to do when we aren't able to bury someone and there's a backlog, and all of these things that these folks are dealing with that we're unaware of. So we have a chaplain and a reverend, and she used to be in law enforcement, talk about her experiences and how to, again, support our spiritual caregivers and the people that are really on the ground, really helping these families. So that's going to be one focus. And then medical workers. So we have nurse and doctor, an emergency ER doctor. He also does street medicine with the homeless. And he's going to be talking about the trauma and exhaustion that a lot of our medical personnel has been experiencing. And we open this up to anyone working in the medical field, be it the janitorial, the reception staff. They're seeing and experiencing this firsthand. And again, the ways that we can support these health systems and healthcare workers to deal with what they're having to face every day. And the ongoing grief all of these people are facing and having to deal with. The last webinar will be the protection for healthcare workers who are doing the vaccine clinics that are working in inner cities that are underserved and that don't have a lot of resources. Those people that are really offering the support as grassroots and public health folk who are really out there, going into the homes, working in public health clinics, and working and seeing the underserved, the poor, the undocumented, and all of the stresses that they're experiencing dealing with families with no food, no medical care. So those public health workers, we wanted to honor them. And all of this will have a psychological first aid foundation of how we can stabilize and offer support.
Stabilize and calm, and then push on out
Mm-hmm.
to the services.
Mm-hmm.
So I'll just read
Mm-hmm.
through really quick. So April 7th is the First Responders Resiliency, Putting PTSD Out of Business. That's with Susan Farron, who's the founder of First Responder Resiliency. That's your first webinar. April 14th is Naming and
Mm-hmm.
Reframing, Supporting the Essential Work of Spiritual Caregivers in Our Communities. And that's with Reverend Suzanne Malloy. April 21st is Caring for Our Frontline Medical Workers. And there it's Jason Pritsowski, who's an emergency room physician. I'm not sure if I got his name right.
Mm-hmm. That's right.
And then on the 28th, Workforce Support and Protection for Health Workers in Underserved Communities. And the presenter there is Courtney Mark Gray, a terrorism and disaster program consultant for the National Center for Child Traumatic Stress. And that's the organization where psychological first aid was really first developed and documented. And they're the trainers of your trainers. Is that right, Jina?
Mm-hmm. That's right. That's right. And Courtney's in Boston, or currently in Boston. Yeah, they're exceptional individuals.
This is a great lineup of really interesting people. And I really do hope that, and it is open to anybody who wants to sign up, but it's targeted for various first responders. And then they'll be available for free afterwards on the PsychAlive website.
Yeah.
Well, Jina, is there anything towards the end of our conversation? And it's been a funny one because this is a serious solution, by the way. I feel like we're naming a real problem that has been out here forever, but it's been heightened in this last year. The stress that we've all been under, but it's particularly the people who've been out there on the front lines. So that's the problem. And then this is a solution you're offering, Jina. But why don't we talk about what's making you, is there anything that's making you hopeful or optimistic right now that you want to share with? That's a way where we usually end this conversation.
I feel very hopeful for two things. I wanted to share something about our presenters and about the series. Each one of them has a fantastic sense of humor. I was amazed when I spoke with them. I want to say that I'm hopeful because I'm still laughing. And we're all still finding the delight in life and the humor, and that I see more community developing out of this pandemic than I have in a long time. Even though we're isolated and at a distance, we're more connected in certain ways than I've seen in a long time. I feel people are reaching out to each other and wanting to help, and also reaching out more for support. I think there's been very positive things that have developed. I mean, even in my own personal life, I've slowed down. I'm working from home, and I miss my life, but I really feel like I've gotten to know myself, know my family and my friends and my community in a whole new way. And I do see that there's been a lot of positive growth from what we've experienced. And each of us, it's a worldwide experience. Everybody in the world right now is impacted by this pandemic. We're all on the planet in the same boat.
Definitely. And
universal.
It just occurred to me. I mean, we talk about post-traumatic stress disorder, but there's also post-traumatic growth. And that's the goal, right? Is to move from being shaken out of our normal lives and going downhill, or shaken out of our normal lives and finding something different and growing from this experience. And I feel inspired by your discussion of humor, and also that idea of getting reconnected with yourself and your community in a different kind of way. And I see that also. And I appreciate that, Jina. Thanks so much for sharing that perspective.
Yeah. We all have a common language. COVID,
exactly.
We have a common lingo. And so how are you doing with COVID? Well, so it's
COVID's fine.
It's across the board. We wanted to find a global solution where we were all on the same. We are now. We beware what we ask for. I think you and I talked about that the other day, Kristy. Yeah.
Well, thanks, Jina. Is there any last words you want to leave us with before we close the show?
Oh, smile. By smiling, it's amazing what it does to the brain. And reach out to someone and really be kind to yourself. Really be kind.
Oh, Thank you, Jina.
Be a good friend to yourself.
Yeah.
You're welcome.
Really good advice. Thank you so much. And Amelia,
Okay.
any last questions for Jina before we say goodbye?
No, I don't think so. I was really, really inspired by this conversation. Thank you so much for joining us. It's good to remind ourselves to ground ourselves and have those conversations. And I think we forget to do that, but this conversation has been a beautiful reminder.
Thank you very much.
Thank you, Jina, for being here. And thank you, everybody, for listening to the Optimist Daily Update. We promise to bring you these kinds of positive solution-based stories with ideas on how you can get involved and participate in the changing world and help ensure it's changed for the good. Jina, thanks for being here, and thanks for the work you're doing with the Glendon Association and Psych Alive, and also the SBRN, the Santa Barbara Response Network. I think we need more of those kinds of approaches. I wish we could have compassion centers like that all over the country. That would be a really great organization to put together. But with the Optimist Daily, in the meantime, we promise to keep covering these current events with accuracy, legitimate sources, and offering you information needed most to chart new paths for all of us.
And please consider becoming an emissary at optimistdaily.com and help us make our content free to anyone who needs it, by anyone who can.
Thanks, everybody. Thanks, Jina. And we will be back tomorrow with a regular show of just talking about solutions from the Optimist Daily. Thank you.
Bye.